Hi, my name is Gunnar Hansson and I work as a junior doctor in ophthalmology in Sweden. And in this video I'm going to go through advanced treatment for dry eye. So if you have tried eye drops and different eye routines and heat mask and so forth, and they have not given you any effect, it can be worth considering to go to more advanced option. In this video I'm going to go through some advanced options available on the market, both of them available in the healthcare system and on private settings. Depending on where you live, the treatment options varies if they are available in the public health system or if they are available in the private market. But normally, like prescription medicine and punctal plugs are available in the public health system, and other treatments such as LipiFlow IPL are available in private settings. The most common prescribed medication for dry eye is cyclosporin. Most common brand name is Carvis. It's usually administered once every evening. It works by reducing the inflammation in the lacrimal gland so it can start producing tears again. The downside with cyclosporin is that it takes a long time until you get full effect. Usually take until 3 to 6 months until you see an effect on the eye. During the first month, up till 15% of the users that use cyclosporin actually get a worsening of the symptoms. But if they are consistent with the eye drops and take them even though they have this initial setback, it actually improves the ocular health afterwards. So be patient and be consistent. If you have a problem with initial stinging, just take a lubricant drop before the Carvis drop. So you take a lubricant drop and then you take the Carvis drop. That way you can reduce the stinging sensation. So that's a trick to reduce the stinging and burning sensation when you take the Carvis drop. Another prescribed eye drop that you can take to treat the dry eye is Lifetime grass. The most common brand name is Xidra. Xidra is a new option for combating the inflammation of the eye. Xidra also provides a faster effects, usually after 4 to 6 weeks, and less stinging than Carvis or Restasis. This medication also inhibits the inflammation of the ocular surface, which is a key to break the vicious cycle of the inflammatory cascade in the dry eye. Common side effects of Xidra is blurred vision for up to 30 minutes after administration and a weird taste in your throat. But the weird taste can be alleviated by just a bit of peppermint spray. Another medicine available for dry eye is corticosteroids, such as Lotemax. This can be very effective during flare-ups of the dry eye and pronounced inflammation. Corticosteroids quickly reduces symptoms such as burning, redness, irritating eye by suppressing the inflammation of the eye. However, since corticosteroids can elevate the intraocular pressure and therefore cause glaucoma, it's important to just use corticosteroids for a short period of time. So if you have a bad flare-up of your dry eye, then it can be worth considering using corticosteroids, but it cannot be used as a long-term treatment. And if you use corticosteroids, you should always check your intraocular pressure regularly. For more long-term inflammation, always use Xidra or Carvis/Restasis instead, because they also reduce inflammation but don't hold these severe side effects. Another treatment available in some countries is called PRGF or Autologous serum. This is a treatment where your own blood is used. The blood is centrifuged and your blood cells are removed, and what remains contains anti-inflammatory cytokines, growth factors, and antibodies. This fluid is applied to your eye and can decrease your symptoms and start the healing of the eye. Research has shown that this treatment significantly decreases your symptom, decreases the inflammation of the eye, and improves the tear volume of the eye. It's been done a lot of studies on this PRGF drops or Autologous serum drops, and they actually shown quite good results. A lot of study has shown a 30 to 40 decrease in your dry eye symptoms. PRGF helps the eye to heal by reducing the inflammation and initiate the healing of the ocular surface. This treatment has actually been shown to have an effect on a broad spectrum of patients, from both to mild symptoms of dry eye to severe symptoms of dry eye. So it helps both patients suffering from dry eyes due to Sjögren, due to post-LASIK operation, due to MGD, and in a Spanish study, the 89% of all patients participating in this study actually had an improvement of their dry eye symptoms. Another study actually shown that 75% of all patients using PRGF drops doesn't need another treatment for the dry eye. So just the PRGF drops was sufficient to treat their dry eye. This treatment is, as I said in the beginning, available in some countries, for example the US, but in Europe it's not available anywhere. And we are trying to make this treatment available in other countries as well. So if you are interested in this treatment and it's not available in your country, feel free to sign up in our interest form in the app so we know which countries that it is an interest in for this treatment. Another treatment available for patients with dry eye is Punctal plugs. This treatment is best if you have the dry eye due to ADDE aqueous deficient type of dry eye, for example Sjogren's. And if you have Sjogren's, Punctal plugs may be a good option for you. Punctal plug is available for most parts in the public healthcare system. Punctal plugs are small plugs placed into our puncta, so the tear drainage channel. So we prevent the tear fluid to drain through our draining system. This increases the moisturized level of the eye and therefore reducing your dry eye symptoms. They can be either permanent or temporary. As I already stated, this treatment is best if you suffer from ADDE. If you have the evaporative kind of dry eye, such as MGD, this treatment may not be a good idea because waste material may remain in the eye and therefore exacerbate the inflammation. Another treatment available for dry eye is LipiFlow. LipiFlow suits the people suffering from MGD. LipiFlow is an advanced treatment that combines heat with controlled automated compression of the innermost part of your eyelid. The treatment aims to empty the stoppage or blockage in the Meibomian gland, to empty them so we can have our natural flow of oil out to the outermost part of the tear in the lippy layer, so to prevent the tear from evaporate. This treatment is completely painless. It takes up to 12 minutes and most patients doing this treatment actually experience it as quite pleasant. So if you don't feel like your heat mask and eye massage is enough, you can try this treatment. But it actually works in the exact same manner. So you apply heat and then you compress to express the lipid from our Meibomian gland. The effect from this treatment varies. Some patients experience quite a lot of improvement, while some other patients doesn't feel any improvement after the treatment. But if you have enough of glands left and your glands are blocked, this treatment is a really good option. It differs how often you need to take this treatment, but usually maybe like 1 every 3 months or something like that. Another treatment that can be beneficial for MGD is IPL, intense pulsed light. This technique involves light pulse directly on the skin beneath the eye, where they generate heat that softens the stagnation of the Meibomian gland so the oil can flow freely. At the same time, superficial blood vessels and inflammatory changes are treated. This can be extra beneficial if you suffer from coexistent rosacea, which are often a contributing factor for ocular inflammation. This treatment is usually painless and usually do this once every 4 weeks, and each session takes around 10 to 20 minutes. And the IPL treatment is offered mostly in private sectors across Europe and the US. Another treatment similar to LipiFlow is iLux. So iLux is a handheld medical device that uses heat and compression to help express the oil from our Meibomian gland. So very similar to LipiFlow, but the difference is that the physician can measure the oil flow in real time, and that allows a more precise treatment. And this treatment is also most beneficial for the patient suffering from MGD and offered in the private sector. Another treatment you can do for your dry eye that is actually offered in the public healthcare system in many countries is Scleral lenses. Scleral lenses is a lens that rests on the sclera, so the white part of the eye, and it creates like a moisturizing chamber over the cornea. So it prevents the evaporation and it keeps the eye moisture throughout the day. This treatment is especially useful if you suffer from severe dry eye or if your cornea is irregular. These lenses are custom made, so you have to do them at the clinic to get the exact measurements to do so they fit your eye perfectly. So they have to be made by an optometrist or an ophthalmologist. The downside of this treatment is it can be quite uncomfortable to wear them and can be quite tricky to learn how to use them. But if you use them, it's been shown in research to give quite good result for dry eye. So Scleral lenses shown a lot of improvement in dry eye patients. So it can be worth considering, but be aware that it can be quite uncomfortable to wear, and it takes some time to learn how to use them. Another treatment that is quite unusual is amniotic membrane. The amniotic membrane from a fetal sac can be used as a biological lens for the eye. This amniotic membrane releases anti-inflammatory substances and healing substances, and it helps the ocular surface to heal. This treatment is used in extreme severe cases such as corneal ulcers or chemical burns. These lenses are very uncomfortable to wear but effective, and if you are a patient suffering from dry eye, you already feel a lot of uncomforts in your eyes, so it can be worth considering for all the benefits that come with it. Typical treatment duration is 4 to 7 days, and after this treatment, some patients actually feel that their eyes is kind of restored. It's very difficult to access this treatment, and it's only available in some clinics around Europe and US. Thank you for watching this whole video. I hope I brought you some clarity. Thank you.